It's the final day of level 4 lockdown in South Africa, and from tomorrow, June the 1st, our environment is set to change once again. Taxis and buses will be allowed to operate throughout the day with no time restrictions, but with limited passengers. Limited domestic air travel will be allowed under level 3 of lockdown for business purposes only. Game parks and private game farms may be open. They may open the gate to visitors again. That's from Monday. But visitors may not cross provincial boundaries to reach game parks for these drives. Under level 3, provincial borders are technically closed to those who cannot show their need to travel is for essential business. Alcohol may now be sold from home for home consumption. Cigarette may not be. Schools are opening, or are they? And places of worship are allowed to function with less than 50 people, but many religious leaders are hesitant to be the first to take the plunge. In short, it's chaos. This is the 12th Sunday podcast, courtesy of Synthesis Technologies. I'm Howard Feldman. A very good morning. Dr. Anton Meyberg, pulmonologist and COVID expert. Welcome back. How are we doing?
Thanks for having me yet again. I like actually what you said there. I think we are in chaos. And I think the only way to explain it is saying when I watch people putting on masks or taking off their masks or not wearing masks, I now understand why contraception fails. So it makes sense. There's lots of chaos at the moment. Okay. I mean, if we have to look at the worldwide numbers, there's 6,172,333 cases, 371,000 deaths, and 2.7 million cases resolved. The United States are topping the bill at 1.8 million cases with 105,000 deaths. And South Africa are slowly creeping up at 30,967 cases with 643 deaths. Yesterday, 1,700 new cases. There have been 16,000 recoveries. The Western Cape is our epicenter at the moment with over 20,000 cases. And Eastern Cape is slowly creeping up and getting close to Gauteng, both sitting at about 3,700 cases. As you said, the sale of liquor starts from tomorrow, so that's going from 9 a.m. to 5 p.m. And exercise is now being allowed from 6 a.m. to 6 p.m. So that's a positive side of this whole story.
The one thing that concerns me, I mean, there are many things that concern me, but one of them that I found completely perplexing is that there are more than 20,000 cases in the Western Cape. There's just under 4,000 cases in Gauteng. Surely opening up domestic travel between Cape Town and Johannesburg is potentially a recipe for disaster.
So I have to agree with you on that. I do think it is a disaster. And remember, it's domestic travel for business purposes only. But yes, you are going to seed the virus. You're going to promulgate the virus and let people spread the virus if you allow them to travel in airplanes and travel to different provinces. So if you get people from Cape Town coming up to Joburg, they're going to spread the virus. And it's a big problem. I don't really understand what government's thinking is on that point, but I don't think it's a good idea.
All right. And there are a couple of things as well, but we're going to go through various conversations. Obviously, we're going to talk about the latest in treatment. We're going to be talking about schools. We're going to be talking about religious places of religious worship. Let's start off, though, with the one that is always somehow close to our hearts, which is exercise. People wearing masks, people not wearing masks. Can we get that out of the way first, please? I wrote an article on Friday for the South African Jewish Report saying if you don't wear a mask, you are plain and simply selfish. Do you agree with that statement?
I do agree with that statement. And once again, when I went for a run this morning, I did see multiple people not wearing masks. Look, we're not a police state. It is compulsory to wear your masks. People need to do that. They need to protect themselves and they need to protect others. And it is a pure selfishness that if you don't wear a mask, you're being selfish to people around you and to your own families. So guys, please put on your masks. It is compulsory for a reason. We are trying to protect each other and we're trying to protect ourselves.
All right, so let's just start talking about schools. A couple of questions about this. We aren't 100% sure. There's some confusion. I did speak to the director of the Jewish Board of Education, Rabbi Kasef, this morning. He says grade 12s are going back tomorrow, and grade 7s per government gazette. I know that there's some confusion because of the latest information. We're not going to be able to answer those details fully here, but let's just talk about the school issue. Peta says her sister asked a question: once her kids go back to school, should her daughter be washing her hair every day when she comes home?
That's a fair question. I think we've got to take it back a step. And remember, we've said many times, children are not super spreaders. They are not the major transmitters of the virus. People are very worried about sending their children to school, but they've got to realize, especially with level 3 coming in tomorrow, a lot more parents are going back to work. So the problem will actually be the parents who are going back to work, who are going to bring the virus home with them, and not per se the children who are going to school. The parents are going to be the problem. We have said previously that children are going to school, should come home, change their routines. When they come home, they should have a bath, they should get out of their clothes, leave their shoes at the front door, and have an earlier bath. And if they want to wash their hair on a daily basis, let them wash their hair on a daily basis. Doesn't mean you've got to use shampoo every single day because you'll destroy your hair follicles. But yeah, it's not a bad idea to wash your hair on a daily basis, especially if you've got long hair.
A lot of the concern around wearing masks, people say it's very claustrophobic. How are the kids going to manage? Is there a certain amount of time that after we wear a mask, that it actually becomes dangerous for us, that we may be breathing in stale air, bacteria, etc.? People saying they get headaches after a short while. Can we talk to that?
So my thought process is, it is difficult to wear a mask for long periods of times. So what I would suggest, what they do at the schools, is that they should have mask breaks. In other words, allow the children to go outside, be far apart from each other, and actually take off their masks every hour for a few minutes just to breathe in ambient air where they're not exposed to other people. It's a good idea because the children get to breathe. They get to recirculate their lungs with fresh air. And it's not easy breathing in masks. But a lot of people say it's dangerous to wear masks. It's not dangerous to wear masks. You've got to look at these cases where surgeons operate for 8 hours at a time and are fine wearing masks in small contained rooms where there's not great oxygen flow, and yet they manage, they don't pass out, they don't get sick from it. So it's not unsafe to wear the mask.
There were even some articles that people were sending me from China, where people, kids maybe ran a race and then got into physical trouble because they were wearing a mask with it. Is this nonsense?
The truth is, we shouldn't be doing any extracurricular activities at schools at this point in time. Rather stay away from it. Don't do it. But if you look on the road, people are running with buffs, people are running with masks, and they're managing okay. But once again, if you run for a minute or 2 minutes with a mask, it won't cause you any damage if you do one of those type of races. We've got to remember that we do say that children under the age of 2 and possibly under the age of 3 shouldn't be wearing masks. We've said that because of the increase in their positive index expiratory pressure and the hazard of choking. So we don't expect them to wear masks, but everybody else should be wearing masks.
Cheryl wants to know, what does the doc advise regarding these sanitizing tunnels for a school? Are they dangerous? Are they worthwhile? What's your thoughts?
So initially we thought they were very good ideas, but there are reports coming out now that they aren't so good to have at schools and around people because of all the toxins that they're spreading. We don't know what it's doing to your eyes. We don't know what it's doing to your skin. There's not a lot of unvalidated studies going around about it. And although it looks like a great thing, we're quite unsure at this point in time. So let's watch the space.
Peter wants to know, as we move into level 3, are we any clearer who is more susceptible to getting this illness badly? I don't mean the obvious, like the elderly and those with diabetes, hypertension, etc. I mean people who maybe have had TB, have had cancer, but are in remission, have had pneumonia, bad bronchitis, etc. And what about smokers?
So that's quite a few questions. And I think if we look at someone who's had TB, if you've had TB and you've recovered fully, then you're at no higher risk than anybody else. But if you've had TB and you've got something called bronchiectasis, where you've destroyed your lungs, you are at a much higher risk. Smokers, much higher risk. Why? Because they've got increased ACE2 receptors, and we know that the ACE2 receptor is the receptor to which the virus binds. So smokers, COPD, emphysema, much higher risk. Diabetics, hypertensive, higher risk. We do know that. These are the type of people we've got to worry about. But if you've had pneumonia, you will be unwell for a few weeks, but eventually your risk factors will go down.
Lauren wants to know, are antibody tests available in South Africa? And if not, when will they be?
We don't know when they'll be available. They aren't available at present, but we are waiting for ones that are extremely highly sensitive and specific. In other words, the high positive value and a low negative value. We want them to know, we want to know exactly that when you're diagnosed with it, it is you have got the antibodies, not you don't have the antibodies and it's a negative result. So we're waiting for those specific tests.
Because I did speak to somebody overseas and they said what they are seeing is that not everybody that has been COVID positive is testing positive for antibodies. What does that mean, actually?
So basically, there's different affectation of how badly you get the COVID disease. There's the mild, there's the asymptomatic, and there's the severe. We find in most of the people who are moderate to severe, they're getting better antibody clearance in their body, and they're making better antibodies to fight off the virus. It's still a novel virus. We're still learning a lot about the virus, and we don't know if asymptomatic people who don't manifest symptoms at all are making the antibodies against the virus. So if you've come back with a negative result, in other words, you don't have antibodies against the virus, then you can get the virus again. That is a point. People ask the question, can you get the virus again? It's like influenza. It's like RSV. You can get the virus again unless you've got the antibodies to it or you've had a vaccine against it.
Right, because Eric is asking the same thing. He says, can a person be sick with COVID a few months apart? And the answer to that is probably yes.
If you get the antibodies.
If they don't have the antibodies.
Correct.
So it might not help us. Certainly I maybe thought ignorantly that wouldn't it be cool if I've had COVID but haven't known about it because I've been asymptomatic? Well, then there's more chance that I don't have the antibodies. And I can
Once again, we just don't know yet. We don't know. There's not enough studies, but that's our thought process.
Right. Okay. And B wants to know, how often should you take the COVID test? Should you take?
That's a difficult question. That's a very difficult question. First of all, you've got to realize it's not a cheap test. It costs about 850 Rand plus minus for the test. Medical aid won't pay for it every single time you take it. There's got to be a reason for you taking it. If you've been exposed, yes, you should take the test. But should you be taken on a daily basis? No. Should you be taken regularly? No. Rather, if you're worried about it and you're not sick, rather isolate yourself. Stay away from people.
Whoever wants to know, and it's an interesting question, is it possible that there'll be a break from COVID before vaccine comes out? For example, a few years ago, swine flu was going around as a bad bug. Is it possible that it'll come in waves every season?
So that's what they speak about. They speak about waves, that it comes in first wave, second wave. We're still in the first wave at the moment. We don't know when the second wave will happen. If people start getting a bit better or if the virus slows down for it, there's a second wave potentially that will come. We do believe this will be a yearly virus, and hopefully with the vaccine coming, it will be similar to the normal coronavirus or a similar influenza type thing that we'll be able to fight against with vaccines. But once again, time will tell. We've got to wait for these vaccines to come, and we're hoping for herd immunity to develop over the next few months, however long that's going to take. Remember, herd immunity, you need at least 60 to 80% of the population being immune to the virus.
Can we have herd immunity without a vaccine?
You can, but you're going to get a lot of sick people in that process. So yes, you will have your majority asymptomatic, but you will have to have a lot of sick people in order for people to transmit the virus to other people and be around people who get the virus from them. So it is possible.
How are we doing with the vaccine? What's the latest on that?
So there's a new vaccine that's in trials, it's in phase 1 trials. It's called the adenovirus coronavirus vaccine, which has a rapid influence on the T helper cells. That's new. That they're working on in Beijing at the moment, and it sounds very promising. And then from a treatment point of view, the new treatments is a combination of what we call remdesivir, which is an antiviral drug, and tocilizumab, which is an interleukin-6 monoclonal antibody. And they're looking at combining the two. That's in phase 3 trials at the moment to work together to try and fight against the virus.
You are certainly seeing patients here in South Africa, treating patients with COVID-19. What are you seeing? Can you give us a sense? Because for many of us, it seems a little bit far and a little bit unrelatable. You living with us every day of your life, you are seeing ill patients. I'm assuming if they're in hospital, they are properly ill. Give us a sense of what you're seeing.
So I think it's a very good question, because I think people have once again become complacent. People don't think it's going to happen here. It's not happening here. There's only 3,700 cases in Gauteng, but 20,000 in the Western Cape, so we don't have to worry about it. That's not true. We are seeing it in our hospitals. It may not be put out there in the media, but we are seeing it, and we are seeing sick people. And as you correctly say, if they're in hospital, these people are sick. And if they're sick, they're generally in ICU. And that means that we are what we call donning and doffing multiple times a day. In other words, I'm putting on multiple pairs of different types of clothing to protect myself, and have to shower multiple times a day so that I don't get the virus transmitted. And we are seeing sick people that are requiring these medications, such as tocilizumab. We don't have remdesivir available in this country at this point in time, but we're giving a lot of medications to try and help with these people. And these people are sick. They really are sick at this point in time. So please do not be complacent. We are seeing it. There are going to be more. We are now going through our cold spell. So we're going to see other viruses developing as well at this point in time. We haven't seen a massive influx of RSV or influenza at this point in time because everyone's been self-isolating. Once people go out into the community now, and once people go back to work, we're going to see other viruses, and we're going to see the spread of the coronavirus further. So we are going to see extremely sick people. Do not fool yourself. This is real. This is a real, tangible thing. And when people get sick, they really do get sick. That being said, 70 to 80% of the population who do get it will not be sick. But we worry about the people that do get sick.
Mm-hmm. It's interesting because there is the sense that it's totally removed from us because we don't, somehow there's a stigma, and we've spoken about it before. There seems to be a stigma around it, which means people don't talk about it. Why do you think that is?
I think people are scared to say that, if I know somebody who's got it, should I be isolated? Should I be away? Then I can't go to this and I can't do that, and I've got to be here and I've got to be there. So people are scared of actually saying that I've been in contact with somebody, rather than taking the responsibility of saying, hold on, I've been in contact, I've got to isolate myself. People are scared of not being able to go to social functions, which they shouldn't be going to in the first place. There's no time now. There's no social functions. There's no play dates. There's no spending time with family members. You've still got to stay in lockdown. Our lockdown is still effective, albeit it's changed for certain communal religious gatherings and that type of thing and going back to school, but you're still in lockdown. And I think that's why people are saying, well, it's not a bad thing. No one's talking about it. And because no one's talking about it, no one's realizing the urgency and the reality of what the virus actually brings.
You've come out and said that you think it's a very poor idea to open places of worship. You've also come out and said very strongly that you believe it's a good idea for our children to go back to school. Can you differentiate for us the difference? Because many people
I think it's very important that, and I think it's very important. And I heard a talk by Professor Muddy, who's a immunologist and a virologist, and he basically explained it like this. If we look at a population of 1,000 people, let's say, over about a year, 60% of that adult population will get the virus. That means there'll be 600 people getting the virus, okay? Of that 600 people, 70 to 80% of them will be okay. But the 20% of them will need to be in hospital, and of them, lesser percentages will be in ICU and will be sick. When you compare it to children, let's say you take 1,000 children, we're looking at about 70 to 80% of children that could get it, but about 70 to 80% of those children will be mild or asymptomatic, will not require any treatment, will not even know that they've got the virus. And when you compare the numbers, when you're looking at 25 out of 1,000 adults landing up in hospital to maybe 1 out of 1,000 children landing up in hospital, it makes perfect sense. You've got to understand children are not super spreaders, and it's highly rare for children to transmit the virus to adults. Adults transmit the virus to adults. Adults transmit the virus to children. Children have got a different type of immunity. They don't have the amount of ACE2 receptors that adults have got. But that doesn't mean that by them going to school, they can't bring virus home with them and transmit it to their grandparents. It still is possible, but at a lesser degree. And I think that's the point. Now, when you compare that to going to synagogue or the mosque or the church, there's no social distancing there. Everyone's going to be close together. These are communal functions where people socialize together. And if you're taking 50 people and you're putting them in a room, even if you socially distance them 1.5 meters away from each other, they're still touching things. There's still what we call fomite transmission. So you touch something, a bacteria, virus, fungus can be transmitted from that book to another book. Even if we say, bring your own books, there's so many different nuances in each religion of doing in different types of communal gatherings that you're bound to transmit the virus between people, whether during the service or after the service. And that's why we're vehemently against reopening of the religious institutions at this point in time.
Right. Even given the fact that government has announced that that they might open, that they may open, it doesn't mean
just because they've given the announcement doesn't mean we have to agree with it.
All right. I think that's an important one. Luke wants to know, considering the current stats and the progress of the same covering the past few months, do you think that we will be at level lockdown or lower by September?
Luke, that's a fine question that no one has an answer to at this point in time. We've still got to wait for our virus peak. We've still got to wait to see when the second wave is going to be. We've still got to wait to see, now that things have changed and now that there's going to be domestic flights for business people, etc., what it's going to do to the different provinces, how more people are going to get affected, how many more people are going to get sicker. And so we don't know just yet when the level is going to go down. But when it does go down, it doesn't mean that we're getting better. There still will be high virus transmission.
I want to go back to the treatment. Gail says COVID-19, and you're going to have to help me with this, is an antiphospholipid syndrome. What are the implications of remdesivir? You mentioned it before, being available. When do you think it'll be available in South Africa for the treatment?
Let me just correct you on that. COVID-19 is not an antiphospholipid syndrome. I think the question is more, is someone with antiphospholipid syndrome more sort of vulnerable to be getting COVID-19? You see, antiphospholipid syndrome,
okay, I understand. That's an important
is a syndrome where you're basically, the proteins fight against your blood cells. So you had a higher probability of getting arterial and venous thromboembolism, which is clots. You had a higher probability of getting miscarriages and stillbirths. And these type of people sometimes need to go into anticoagulation. Now, we know with COVID-19, and I'm not talking about the mild, the asymptomatic, I'm talking about the moderate to severe people who will end up in hospital. We give them anticoagulation. In other words, we give them medication so that they don't promulgate blood clotting in their system, because they are at a higher risk at blood clotting because of endothelial dysfunction, because of immobility, because of oxygen demand and supply, and because of excessive inflammation in their airways and their lungs. So they're at a higher risk, and we cover them with anticoagulation. And we've got formulas working out the amount of anticoagulation you need. In other words, we look at something called a D-dimer, which I've mentioned before. And the higher the D-dimer, the more amount of anticoagulation we give them. So is someone with antiphospholipid syndrome more prone to get COVID-19? And if the person is well controlled, then the answer is probably not. But if you do have antiphospholipid syndrome and you are sick, you are one of the definite people that need to go into anticoagulation if you land up in hospital. Would remdesivir be necessary for your treatment? I think remdesivir is a blanket drug that would be used for anybody who's moderate to severe if it's available, together with drugs like tocilizumab, together with other drugs like corticosteroids, together with your vitamins, together with high doses of oxygen and all other medications. So it's not just a simple one drug that could be given. Remember, there's no cure for this virus at this point in time. All the drugs we are using are drugs we are hoping will help and work together to make the person better and decrease the mortality rate and decrease the amount of time the person stays in hospital.
Okay. Kim says, my father of 83 was admitted to hospital unrelated to COVID-19 and was tested on arrival, which was negative. But after being discharged, he was not retested. He was in an isolation ward. Can or should we retest him privately now? What are the risks of not testing him after being discharged without a test? And she says, I'm a worried fan.
Okay, so that's also a very good question. And I think we've got to backtrack a bit. Any patient that comes into hospital, if they don't have a COVID-19 test in the last 48 hours, they're considered what we call a PUI, person under investigation. They go to a separate ward, but they go to a separate room where they're in isolation, where we've got to put on our full regalia of clothes to look at them until we get a result back. Once the result comes back and the result is negative, they go to a different ward. If this gentleman was in isolation, then it's a very simple answer. Being in isolation means the nurses already are wearing masks, aprons, gloves. The doctors are wearing masks, aprons, and gloves. So if he was negative and he's been in isolation and they've adhered to all the rules, it's unlikely that he'll be positive and he doesn't need to be retested again. Also, any person who's been in hospital, they don't have to be tested again on discharge. We also look at other parameters. We also look at temperature, we look at blood results, we look at respiratory. There's a whole cohort of different things we look at and clinical manifestations to try and put it all together so we know who to test or not to test. So people who are being discharged don't necessarily have to be tested again.
Lindy says, I'm a bit worried. I'm 64 years old. If I go into hospital with COVID, are they more likely to treat a 30-year-old?
So that's an ethical question. Okay? And each hospital has got an ethical committee that has been now elected due to this COVID virus for that type of question. In short, Lindy, no, you're not less likely to be treated. But if we're in a situation where your hospital has got 20 ventilators and you've got 19 ventilators that are being used and one more ventilator is used up, and you've got two people arriving at the same time, from an ethical and religious discussion, you've got to look at both parameters to decide who is going to get that ventilator if they both require the ventilator. So it's not a simple answer, and I don't think this is the forum to answer this. It's a far bigger issue than just a few minutes of discussion.
And a very difficult one, because I know that that is ultimately why we are trying to flatten the curve, because you try and avoid that type of situation from even occurring. That's what they were dealing with in Italy when they had this uncontrollable situation that almost collapsed the medical system.
Once again, they didn't flatten the curve. We have flattened the curve and allowed ourselves to prepare for these eventualities. And please God, we will still maintain and be able to prevent these things from happening. So please God, Linda, you won't have to worry.
Reuben says, my boss wants us back in the office on Monday. What needs to be in place before we go back, and to feel comfortable that I'm not endangering my family? Before Dr. Meyberg answers that, Reuben, there are very, very strict governmental regulations, and your company needs to make sure that they have fully complied with that. They've got to have a compliance officer. They've got to test, just by regulations, and I'm not even talking medically. Dr. Meyberg can answer the question medically, but there are very, very strict regulations in terms of what needs to be done in an office. And if your company is not compliant, then you are absolutely not obligated to go back.
So I think you're right with that regard. With regard to the medical side, we've got to look at entirety, and it comes back to the question of teachers going back to school. Teachers who are over the age of 65 have got comorbidities. The only way a teacher over the age of 65 can go back to school with comorbidities is if it's safe for the teacher. They cannot go back if it's not safe for them. Every school has to look at what their comorbidities are. Is it safe? Are they well? What medication is, and work out if it's safe for them. So, Reuben, when you're going back to work, if you've got comorbidities, it depends what those comorbidities are. It depends if you're a sickly person or not. You have to disclose this all to the people at work. And going back to work now, there will still have to be the regulations of the 1.5 meters distancing between each worker, as well as hand hygiene, temperature taking, wearing your masks, and hand sanitizing the whole way through.
I want to end it by just, obviously we need to ask what the good news is, but before we get there, there's so much confusion, as I began this podcast saying, in terms of regulations. One of the comments that President Ramaphosa made was that it's basically in our hands in terms of our own safety and security now, in terms of this virus. What is your overall recommendation that we adhere to? Because we are very clearly we very clearly cannot just be guided by what we are and are not allowed to do.
So I think in essence, we as South Africans are not the most obedient of people. And when it's said that it's in our hands, that's quite a bad thing, okay? Because we need to be really take the bull by the horns here, excuse the pun, but we've got to look after ourselves. And it's the same thing with wearing the masks while people are running. And if that's the indication of how things are going to go, then God bless us, because we're in huge trouble then, okay? We've actually got to be policing ourselves and policing workers around us and policing people around us in order to protect ourselves. It's not as simple as just going back to work tomorrow and everything is going to be hunky-dory. You've got to look after yourselves, and you've got to look after the people around you. And I think time will pass in any event. And you can either spend it basically creating a life you want, or you can spend it creating a life you don't want. But either way, at the end of the day, the choice is yours, okay? As my little kind of discussion at the end always goes, I say sometimes you just need to hop onto your own unicorn and fly over your own rainbow. So the good news is we can beat this. We will beat this, and I have no doubt we will beat this. Yes, there will be troubled waters along the way. And yes, we're going to have a few ups and downs. But if we work together as a country, as a people, as a community, and look after each other, we will beat this.
Dr. Anton Meyberg, thank you as always. I'm Howard Feldman. This has been the Synthesis Podcast. We record every Sunday morning. This is our 12th week that we have recorded this. We'll, of course, be back next week. We don't expect anything different. We do hope that you'll continue to send us your questions. They make it very important. They make it very worthwhile, because that's a very good indication as to what everybody is thinking about and concerned about. Thank you, as always, for participating. Have a great day. be safe, be responsible, and don't be selfish.